Hello everyone, it's Charlie and Rumina for our update on our product roadmap that we're sharing with all of our therapists today. Do you want to know anything?
No, that sounds great. Back on.
Cool. So today I'm very excited. We're sharing a new feature that we've been rolling out across the platform and we've been building for about 6 months, and it's called Beyond Therapy Plans. So I'll do a little bit of introduction to it, then I'm going to hand over to Rumina, who's going to show you how the product works, how therapists use it, and then we're going to try and answer some of your questions. Let's have a look. It's always good to have an agenda at the beginning of a presentation. So the first thing we're going to do is talk about why. Why have we even created this Beyond Therapy Plan product for you all? We're then going to talk about what is it. Ramina is going to show you it in detail, but also how it works and how it can affect your services that you deliver to your clients. And then last but not least, we've got some impact questions about how do people like it, how are the outcomes, but most importantly, how can people start using it. As you can see, we've got Beyond Therapy Plans across all of them. So if you're only here for 30 seconds, try and remember that this is about Beyond Therapy Plans. So you got me first. First of all, why? So unbelievably, about 6 or 7 years ago, when Rumina and I first started HelloSelf, we spent a lot of time trying to think about how do we help people feel better sooner, but also help them feel better longer. And there's been sort of four massive phases of that evolution. The first was we built an online clinic that serves thousands of people with the best clinical outcomes we can. We're so proud of the technology we built to run that clinic, and I'm so grateful that you guys all use it for. Then about a year and a half ago, we opened that platform to allow any clinician to run their own clinic on the platform. So people can refer to themselves, they can add their own clients to the platform. And that's been growing over the last year, year and a half. And it's been exciting to see how many more therapists get access to some of HelloSelf's amazing technology. And then we really started focusing on the feel better sooner part of our product. It's about like, how do we actually get people to not just remember what happens in their therapy sessions, but actually practice it a little bit every day. And we called that our sooner strategy. And of course, you all remember about 9 months ago, we launched Companion, HelloSelf Companion AI, which works with your members between sessions to help them feel better sooner. And today is the first launch in many about how do we help people feel better for longer. And so we're going to show you how our Beyond Therapy Plans can help support your clients for longer. Because we all know that traditionally offline therapy experience for a member can actually be a pretty terrible experience. People wait too long to get into therapy. They can sit on really long waiting lists. Let's say they do find an amazing therapist, one of you guys, then they get better fast. But then you're really busy. You've got a waiting list, so you have to discharge that person. And then if you're looking at like an NHS system, you can't get back into that system until you're quite ill again. So you get this kind of relapse cycle. It's not been sort of designed to optimize the member, the client experience. And what we've been doing at HelloSelf, you guys should all know this chart, we've shown it many times over the last 5 years, is we've been looking at like how do we get earlier intervention? How do we do super fast matching, make sure everyone works with the correct therapist to give them the best outcome? How do we make sure we make therapy more effective with our sooner strategy? And now we're looking at our longer strategy about beyond therapy. And so this is really about how you can help your clients not just stay better, but keep improving and not go through this kind of relapse and discharge cycle that haunts so many people. So that's the why we're doing it. I'm now going to hand over to Ramin, who's going to show you what is the product that we've developed and how is it delivering for both therapists and members.
Great, thank you, Charlie. Great. So I'm going to share a little bit more about the Beyond Therapy Plan now. And I guess just to, personally as a clinician, I've been very frustrated and disappointed about the sort of revolving door of mental ill health that I've seen in my practice. And we know that, each relapse has a significant impact on longer term outcomes. So, this can be a better time, really. We really do need to think about interventions that maintain well-being, allow people to be able to keep well, stay well, and then go on to flourish and thrive. So that's what I'm going to show you what we've designed now. And this is our Beyond Therapy Plan, the start of it. And I guess what we're showing here is we'd love to invite you to join the HelloSelf platform, create an account, and then be able to create a therapy plan for your client. And this will be very familiar to many of you. This is often what happens towards the end of therapy when we review somebody's goals. We think about what they've learned during the process, what they need to do to be able to stay well, what are those key tools and tips. And really that's a collaborative process that we're then, as therapists, now filling in this kind of Beyond Therapy plan. As you can see here, there's the goals for this person they want to continue to work on. what kind of tools or strategies or tips or learnings that are key to be able to maintain and continue to work towards longer term goals. That's sort of the start of the plan. And then after you've completed this plan, your client then gets an invite sent over via email for them to be able to join and see this plan and think about the Beyond Therapy plans. And as you can see here, this is only £1 a month to start with. So we're really encouraging people to try this out. And then what will happen is the client would register, join, and accept that link. And then our companion here would have a conversation with them around their Beyond Therapy plan. It talks about, based on the information that you put in on that kind of blueprint or that staying well plan, it talks about how things are going with the member. It talks about things that have been difficult in the week, what tips that they could use from their staying well plan or their Beyond plan to continue to move forward. And then it sort of will encourage the person to try the things, all the things that you put in that plan. It's not adding in new knowledge here. It's very much overseen and by you as a clinician, and then think about how they can move forward. And so really this is forming a triangle of care, the client, companion, and also you there working together to keep people well. And what's key here is also intervening early. People do need a bit more support or a booster session to top up. You know, companion is there to kind of also inform us that people need help. So companion can do sort of three things. It can sort of remind the client of those sort of key things they've learned, the strategies they need to implement, and how to work towards their goals. It can also check in with them, so that kind of reflective conversation that I just mentioned around what's working well and what's not so working well and what they would like to try, or set a new goal, for example, if they've achieved their goal. And then we also have some psychoeducation pathways that companion can also help with around, let's say, stress or worry or sleep. So it can coach as well. So it has multiple skills, but again, all overseen by us as clinicians. So the kind of the control is there. And so what happens then every month is that companion very helpfully brings together this report for us to review as clinicians. And I'll go into a bit more detail, but this is sort of the overview that you can see. And you can see it's quite quick and easy to go through and review. So it always starts at the top around a bit of a summary, and it will give an idea of how much the client has been engaging with companion in the tools. So, you know, it says a summary here of what's been going on, what the check-in conversations, the kind of the themes, if you like, from those conversations. And then we'll talk a little bit about the goal that's been set or agreed by you and the client they're working towards, and how that's been going. So for this one, for example, reports more consistent boundaries around workloads. That's been something that's happened, being able to be more aware of some of those physical sensations around of anxiety as well. So it gives you a summary, talks about some of the techniques or tools that you agreed, for example, here, a good enough checklist, and how much the person's been doing that. So it sort of, first of all, gives you an update of what's gone on. And then it will start talking a little bit about next steps and things you would like to maybe try and do. So do you want the person, your client, to continue to do these things? Would you like to add something else in? And actually they could benefit from this. I'm going to add that activity. Companion will also pull things off the plan, say, what about trying this? But again, you know, it's whether it's in the best interest for your clients to say yes, no, or no, thank you, so that sort of thing. And then if you are, obviously you'll have an idea of the client's outcome measures from companion if they've completed them. So you might think, oh, actually, it'd be good to see that person. You can ask the person to come in, you can book an extra therapy session with them, or you can just simply send a message with an update and maybe suggest a new tool if you want to. And then that all goes off to the client as well. And you can do this process every month. So what we're seeing here is a very quick and easy process, but giving us a really good overview of how that kind of Beyond Therapy plan is going, and whether we need to intervene or can just keep going, the client can keep going. And so obviously the idea is that, you know, if we have many members on our Beyond Therapy plans, it then frees up space for us to be able to work with more clients, right? We know that there are lots of people who want to access our care. And so we have to obviously have safety nets and an appropriate plan in place to be able to keep track of our members, our clients. So this is a dashboard that shows everybody who's on a Beyond Therapy plan, and then it gives an indication of their engagement status, the goals that we're working to, but also their measures, because they can crucially then tell us if things are starting to become more distressing for the person, so we can reach out. And then also this idea of how long we've been able to, since we need a review and when we need a review. So you can see those people at the top have missed their review, they need a review from us. So again, that we're trying to make sure that this has been thoughtfully throughout, clinically driven, and actually offering the best care for our clients and keeping them safe at the same time. And so then I guess this is the other side we show within our platform, just to get an indication of our income as well. So you can see here your session income, but obviously now it shows those people on a beyond therapy plan as well, just to kind of keep track of where things are coming. And obviously, we as clinicians, we work very hard to work with people who are distressed and to achieve their goals. And yes, that's a very meaningful work, but there's also something for me around meaningful work about keeping people well and being paid to keep people well and being able to early intervene when we need to, when people need more support, to kind of stop that sort of that relapse into that kind of unwell phase again.
Great. So that's a really good overview of how the kind of product works. And hopefully you could see how you could use that. If you're treating someone at HelloSelf and they're finishing treatment, you could move them into a Beyond Therapy plan. If you're treating somewhere else and they're just coming to the end of therapy, you could just add them to the Beyond Therapy plan on HelloSelf. So they don't need to already have a HelloSelf account. And there might even be people that you've been working with historically that you think, oh, wow, this could really work for someone who I have a checkup with every year or so. And you can invite them to a plan. So there's lots of different ways you can play with that, and we'll show you that in a second. But before we do that, we wanted to start thinking about what impact does this product lead, both to your clients, but also to you, and what questions might you have? So we've kind of pre-guessed some of the questions you might ask. I think there is going to be some time at the end for questions. I think if you put them in the kind of questions box or the comment box on this call, we'll try and get to them at the end if there are any. If we don't get to the end, we'll make sure we come back with an email with all of those answers for everyone. But hopefully we'll answer some of those questions for you now. So the real focus of this product has been obviously to deliver more impact for the member, to keep them better for longer. And the second thing is we obviously want to improve your therapist's income. So like at the moment you only get paid for sessions. How can we create a new income stream for you? But most importantly, we wanted to try and make sure in a world of AI and exploding technology that you can stay in control of what information clients get to ensure that it's of high clinical standards and high clinical quality. So we've really looked at these three areas and we'll show you some of that today. So, Rumina, do you want to talk a little about this one?
Sure. So I think many of us are familiar, the observed relapse rates for anxiety and depression following a course of CBT over a course of 12 months can be as high as 50%. And that's even higher if you start considering people with more severe and enduring mental ill health. So actually, 50% of people returning is not okay. And actually, we need to think about changing that. And we really believe that Beyond Therapy is a step towards being able to keep people well. And it's not only about keeping well, like I said, it's about going on to develop, to flourish, to thrive, to have those meaningful lives that really as clinicians is what we want and what our members would want as well. And so our aim was really to really reduce this relapse rate to 3%.
And of course, that then frees up so much more time for therapists to treat more people. Because if you have a high relapse rate in your year two, you're sort of treating 50% of the people you saw in year one. But if you have a 3% relapse rate, you can get 95% new members in and only re-see the people you've seen historically 3% of the time. So over a lifetime, that can make a huge difference to the number of lives that you can impact. Let's talk a little bit about income. There's always a money question. So I get to talk about this bit. Rumina will focus on the clinical excellence, and I'll tell you about how this can affect your paycheck. So the way that we've set this up is that the member gets charged £40 per pound a month to maintain their Beyond Therapy plan. This is obviously so much cheaper than being in therapy. So it's and lots of these people have been self-paying. If they come through an insurer, they can sometimes get some discounts on these elements. And if they come through corporates, we've also got corporate packages. So they pay £40 per pound a month, and you get paid £20 per month of that in order to just review that report every month. Just slightly less than 5 minutes of your time. You kind of go through, as Rumina just demonstrated, the goals, what that actions and activities, send them a quick message. And so it's a great way of increasing your earnings by £20 per pound a month. And it doesn't cost the member very much at all, especially if that relapse rate reduces so dramatically. One tiny little thing to say is we've discounted the first month for all members to only £1 per member for the first month, because we found that people want to understand what this is, they want to explore it. So we've created a no-risk free trial effectively before the £40 per pound a month kicks in. So hopefully you agree that's great value and really exciting income for you, especially when you see what that could mean over the long term. So therapists on average treat about 100 people a year if they're treating people full time. And let's assume that 50% of them buy a Beyond Therapy plan. That adds up to about £1,000 a month of sort of new income for each therapist. Plus, all of those members sometimes say, actually, I'd like to have a top-up session here. So you can get some ad hoc sessions. And on HelloSelf, you keep the majority of that ad hoc session revenue. So even if you've seen a HelloSelf person, a HelloSelf member in therapy, and get paid the HelloSelf sessional rate, if people are on a Beyond Therapy plan, you get paid the kind of refer to self rate. So you get paid a higher rate for your ad hoc sessions. And this is a great way of using up those kind of free hours when someone else is on holiday or in the day where you can turn and say, I've got an empty slot, I can use it for an ad hoc session with one of my Beyond Therapy members. So this is a small amount of time for you each month. It's a huge impact on your members, and it's a beneficial impact on your income. So you in control. So one of the things that I've been really fascinated about what's been going on in the world for the last year and a half is there's been an explosion of use of kind of LLMs or AI being used by our patients and members. And health and well-being is one of the largest use cases for all of these technologies. So there's been a number of studies, but this one is done by Mental Health UK, where they found that about just a third of people, 1 in 3, we're talking to AI chatbots effectively about mental health issues and well-being needs. And of course, this has created lots of dangers and urgency for safeguards, but it's also created lots of interesting opportunities for us as therapists. Because I promise you right now, all the people you're treating, and lots of them are talking to AI between and then beyond sessions. I was at an event speaking last Friday at the Royal College of Psychiatry, and I asked the group of psychiatrists, several hundred of them, how many of their patients were using AI before they saw their psychiatrist and after they saw their psychiatrist, and as a kind of support to their therapy. And about 90% of people put their hands up. It was interesting. Those same psychiatrists, only about 10% of them liked the idea of using AI in their work. So there's a difference here about the patient is using this stuff, but the clinician is not in control of it. And that's something that we really, really wanted to change. So what we've done with Companion is, and all the ways that Rumina just showed you, is that when the Companion is working with your members between and beyond sessions, the Companion can alert you to risk. So it can call you back and say, hey, this is something we're worried about. Can you take a look at it? The second thing that it can do is it can only discuss with members what you've put in that plan. So this is not an AI that's going out to the internet and is going to suggest, eating tomatoes as an intervention. It's only suggesting the stuff that either you've covered in therapy or the stuff that you've put in the Beyond Therapy plan. So it's very kind of contained and appropriate. And then last but not least, you as Rumina's shown you get these monthly briefs from Companion, and Companion's making it really easy for you to kind of maintain and tweak each Companion's plan. So for the first time, your members can have the experience they're looking for, which is a Companion agent, chatbot agent that they can talk to when they need it. But this is clinically appropriate, clinically controlled, and clinically managed.
Great. So we just want to share a little bit about what our members have told us so far. So actually, we do hear consistently from members that the continuity is in itself is therapeutic. So, many of my clients have had anxiety or nervousness about us ending our sessions. Lots of us to that kind of consolidation period when we start sort of spacing out our sessions to make ending easier. And actually, there is something around actually being able to keep continuing to look at our clients and how they're progressing, even once a month, and then being able, like I said, which has been really helpful to me, to be able to see people sooner rather than them getting in touch again when things are difficult. And we know that this helps people achieve their goals. Lots of our members say they feel cared for, and like Charlie's mentioned, we're really encouraging people just to give this a try, because we do believe this is going to keep people well in the longer term, and that's what we're about. We're about really improving the care that we offer our members. And so we've just started to also get some of our Trustpilot reviews coming through that people are really starting to benefit from Companion, this sense of that reflective space I've talked about, thinking about what my learnings are, really taking responsibility for moving forward and the strategies I've developed through therapy and how I can continue to use these. So that's great to hear that people are finding it a benefit.
So how to get started? I can hear you all hammering on the doors saying, oh, we want to have a go with this product. So we've made it super easy for you. So I've got a couple of thoughts and final thoughts. So obviously, anyone who's already on HelloSelf can just sign up, and it's now activating your account, so you can see it on your nav bar on the therapist account. But what we really recommend thinking about is before you even get onto the product, think about which 5 clients have either just finished therapy or are finishing therapy that you think this could work with. Rather than try and give it to everyone all at once, if you give it to a few, and then you can kind of experiment and explore about how it works. And we think 5 is a really great place to start because some of them won't want to buy the product, some of them may engage, some of them may not. So that makes sure you definitely get 2 or 3 people who are kind of highly engaged. We've been running this product for a while now, and we usually find that between 30 and 50% of members decide to take up their plans. The second thing is obviously you can invite them to the Beyond Therapy plan. If you've been treating them on HelloSelf, that's very easy. If they're already on the platform, you just create them the plan. If you haven't been treating them on HelloSelf, it's also very easy. You can literally go to Beyond Therapy and just add their plan and add their email address. Of course, then try it out, see how easy it is to use, but also see how impactful it can be on your clients before you wanted to start using it for more of your clients. And then I think about all the people you're treating now, who it might be appropriate for, all the people we've just treated, but also all the people that probably come back to you every year or every so many years. You can invite them to a plan if they want. They'll really value feeling connected to you. They'll really value getting those monthly updates from you, and that can actually be it can be therapeutically beneficial to them. Of course, you'll see if you do that, you'll see all of your income. It just appears in your income dashboard, and you get paid that out each month as normal. And of course, you stay in control. And we'd love to hear about anything that you think that we could do to change the features to kind of give you more of the control that you want to do. As you guys all know, we are constantly updating the products on the platform. It's constantly getting better. And this is our kind of first beta that's been going out for the last 6 months, and we're now really pleased with how it's working. So if you want to get fast track access to it really, really quick, we've made a sort of QR code for you just here. Don't know where I am on the screen, there somewhere. So you can just shoot that, take a photo of that with your phone, and that'll take you to a form. You can just fill in your information, and then our team will get in touch or will onboard you to the platform. Especially if you're a therapist who's not already a HelloSelf registered therapist. Obviously, if you're a HelloSelf registered therapist, you can contact the therapy support team, or you can just send us a message through the core product. So I really do encourage you to try and think about those now on this call, write them down on a piece of paper. And this is something you could action this week, because that then means you can kind of see how it works for the next month or 2 before you decide whether this is something that you want to offer to all of your members. So that is a quick run through of our Beyond Therapy plans. I hope you're as excited about it as we are. This is the kind of, the second to last stage in our kind of overall mission of how do we get members into therapy really well and working with the right therapist and give them all the tools that they need? How do we get them to work between sessions really well? Now we're really getting them to work beyond sessions to stay well for longer. And together, if we can all embrace this, we can impact not just our members, not just your income, but the wider society, as we can get more people treated every year. Thank you so much for your time. If you've got questions, you can put them in the question box. We just need to find a way. How do we see the question box? But does anyone have any questions? I'll go on my phone and have a look.
Can we?
There
you go. Click there.
There we are. Click on that. Yeah. Okay. In order to draw on information from therapy sessions, does Companion need to use AI-generated notes, or can it use therapist written notes? Do you want me to answer that one, or do you want to
therapy sessions? Yes, but yeah, I mean, you can.
So yes, of course, for those of you that are on HelloSelf already, you can use your AI-generated notes to brief Companion, but you still will need to create a Beyond Therapy plan, and you can take information from those notes. At the moment, Companion will give you a suggested first plan, and of course, if you've used the platform, it will have a much better understanding of what you've been covering in treatment. If you haven't been using the platform, or you haven't been using the AI-generated notes, you'll just have to fill in that first version of the plan. It's a little bit like creating the blueprint at the end of a therapy course of treatment. So yes, it works with both. The Companion AI-generated notes can be used to create the plan, but it can also be done by the therapist. And it's most powerful when it's a combination of the two. Much like everything we do at HelloSelf, we're trying to create that sort of triangle of member, therapist, and Companion AI working together to get people feeling better sooner and feeling better for longer.
Good.
Should I ask you the second question?
Yeah, can I? Yes, of course you can.
Should I read it out? Can I offer this to clients who are not coming through the HelloSelf platform? I am not registered with you currently.
Yes. So just if you fill in the link like we talked about, yes, you could then be able to find, is there a number to call speak?
Is there a number to
To
call
avoid
and
it.
speak with therapist support team, please? I have not been able to find this
Yeah,
number.
so I think if you fill out this form and put your details on that, one of our team will be in touch. Yeah, and then yeah, absolutely. You don't need to see our clients to be able to benefit from this product.
Yeah, the therapy support team can hate this, but yes, 100%. If you take a photo of the QR code, you fill in that form,
We'll definitely get back to you.
we'll not just do an email back. We're happy to call you back and set
Yeah.
up a call to talk you through the whole experience.
So,
And to give you an idea of non-HelloSelf therapists, we have some therapists that have been doing therapy for a long time. They've got large sort of books of people they've treated historically, and they're looking at how can they use this as a tool to keep all of their members well, but also almost like a CRM tool to sort of manage those relationships going forward.
yeah.
So it doesn't just need people who've just finished therapy. Obviously, it's more impactful for people who've just finished therapy, but it could be anyone that you're treating.
Yeah.
I'll read the next one for you. Can I offer this to clients who have done that one?
You've done that one. Yeah, you can work. Yeah, it doesn't have to be HelloSelf clients. You can offer it to your own clients. Again, register and we'll tell you how you can do that. And then how does the system interpret and manage risk and how do I present this to the client? Okay, great. Perfect. Yeah. So first of all, I think these two are quite connected. So in terms of a conversation with a client, I guess this is a very much a collaborative conversation between you as a clinician and the client about whether this is something you think they could benefit from in terms of ongoing support to implement what you've learned, what they've learned in therapist and to stay in therapy and to stay well. So, always acting in the best interest of what's best for the client and also using your clinical judgment here. So I often talk about we're going to be coming to the end of our sessions. We started to space things out. We do have a kind of a digital staying well plan, if you like, which is used by Companion. You can go on and support you after the work we've done. This is what it involves. This is what it can do. I'll be checking in with you every month to review your progress. If you need to come and see me again, you can get in touch with me through the messaging feature and we can think about another time to see each other. So just having a collaborative conversation about what it can offer and what it involves and also the role that you have. I think that also then sets up the kind of risk. So you're, thinking about who's suitable for this Beyond Therapy plan. You're looking at people who are not needing potentially ongoing support, whose risk is managed, who has a plan in place if things do change, and just having that conversation with somebody that I'm only going to be reviewing every month. So actually, if things do change, what are you going to do? Who are you going to reach out to if you become more distressed as well? So I think there's that kind of collaborative conversation at the beginning about what it involves and how to seek extra help if you need it. In terms of the kind of risk that's been inbuilt, at the moment, Companion, we've set the threshold quite low at the moment because obviously this is a new product, we want to make sure that risk is well managed. So if the client just like now, if the client has a conversation with Companion sort of detects anything risky, it will then say to the person, I can hear that you're distressed. I am an AI tool, I'm not your therapist, and it will signpost the member. And then when you log in, it will also alert you and say, Companion had a conversation with your client. This was what was mentioned. It really helpfully shows you a transcript of what has been said, so then you can evaluate that risk. Because sometimes, like I say, if the threshold's quite low, it might fire towards you and say, "Oh, actually, no, that's just that isn't it." But we've set the threshold quite low, so I think it will then let you know, and then you can then act using your clinical judgment, whether that's reaching out to somebody or that's not for now, or invite them back in.
Great. And then on that risk element, we're constantly tuning that risk algorithm too. So for example, the threshold might be low, but if you turn around and say, actually, I don't see this as risk, I don't see this as risk, the system will learn what you see as risk with each of your members. So it will get better over time. You had a question about how to present that to your client, and then we'll quickly go on to the next question. But we've actually got lots of different ways of people presenting this to their client. Obviously, you could just add them into the platform and we invite them and we give them all the information and explanations. It's really great to bring it up in your last session with the client and discuss it with them. We also are launching this not just on HelloSelf, but with some of our partner clinics. So we have yet to announce who it is, but we have a very big sort of technology partnership with a very large clinic where they are using Beyond Therapy subscriptions and with their members. And that clinic has decided that it almost becomes sort of the next step in therapy. So rather than it being kind of a go, no go option, where they're kind of saying, okay, now I'm going to move you onto a plan because it's almost like a step down treatment plan. So they're kind of building it into part of the treatment plan. So it's really up to you about how you want to clinically present that to your client. There's lots of different ways. But over time, over the next couple of months, we're more than happy to share kind of hints and tips about what's working for different people. I think you mentioned
Yes.
yes, and so apologize if you have already answered this question, but can PMI be used to cover your members' costs? Do you want me to do this one?
Yeah.
Okay, yes. So I'm sorry, I keep having to lean really far forward. So I'm an old
No.
person with bad eyes, and it makes me look huge. It makes me look tiny. Yes and no. So obviously, on PMI, people can get all of their treatment covered with all, we're covered by all insurers. So for their therapy sessions, that can be covered. If they've got a capped number of therapy sessions per year signed off with their PMI and they haven't used them all, then the ad hoc sessions can certainly be covered by their PMI. At the moment, their private medical insurance doesn't pay for their beyond therapy plans. So they would still need to pay the £40 a month. So that wouldn't be covered by their insurer. But slightly jumping the gun, we have some discounts that are going to be offered to people. So, for example, we're talking to both AXA, Bupa, and a couple of other insurers about a discounted rate for their members. So, for example, it could be that if you're an AXA member and you've been using your PMI to pay for your sessions and they come to the end of their treatment, they might get a 10% discount or a 20% discount on their monthly rates. It wouldn't overall affect the fact they still have to pay, but it would lower the cost. Obviously, if we can show relapse rates are reduced by so much, we will be banging on the door of the insurers, showing them how much money this could save them if they covered it for all of their members covered, and then that would be brilliant. But at the moment, it's a self-pay cost, and that's the same with any sort of NHS or corporate partnerships at the moment. They're all self-pay cost. I think that's the last question.
Yeah.
Anyone else got a final question? If not, we're exactly 32 minutes through, which is quite amazing, really.
Yeah.
What's your favorite part about the product, Rumina?
Oh, I thought if we've got reduced overdoing.
So is it the insurer?
The
And
insurer.
we're still in negotiations with the insurers about whether they'll pay those reduced rates. But at the moment, no, the idea would be that we would effectively take that reduction and the therapist would still get paid £20 per pound a month. We're also potentially exploring more premium subscription rates where you might be able to bundle some therapist time in, but those things have been asked for us by the therapist, like could people pay a subscription and get one session and a quarter with me plus the companion, but we're not launching those on day one because they add too much optionality at that kind of choice moment for the member. So no, at the moment it wouldn't affect what you would get paid.
Great, you asked the question. What's my favorite bit? I think can I have two? There are two bits, I think, from my own therapist side, but also from the member side. I think from being very selfish from a therapist side, it's really great to see people go on and continue to do, use the tools that you have agreed with them collaboratively as a therapist, see them try, see them set new goals, and be able to see that, because often people come to see you when they're distressed, not when they're very well. So that's a really lovely part of it, I think. From the member point of view, though, it's so helpful to be able to for them to be able to kind of just have a check-in with me to see how things are going. And then, I know that I can then get in touch if things are challenging and be able to contact people and have those ad hoc sessions and kind of catch people, I guess is also a great thing. I think it's just so easy and quick to use. And the fact that Companion pulls it all together for you is great. So there's I gave you more reasons there, but I'm just very excited about the potential of this product.
Great. Any other questions? If not, we'll give it one more minute and then we'll.
That's it. Okay.
That's it. Okay. Well, thank you so much for your time, everyone. It's been really great to not be able to see any of your faces, but it's really great to have so many of you on the call. And this video will be saved so you can watch it elsewhere. And if you've got any questions, please do hit the QR code, sign up, ask us some questions, or you can email us as normal at hello@helloself.com, and we'll get back to you as soon as we can. Or you can connect with me on Rumina on LinkedIn. It's another great way of doing it. Over and out, you're all. Thank you.
Very much. Bye.